go ahead and get started. So welcome everybody. My name is Heidi DuBois, and I have been in the dental profession for over 35 years. Love every minute of it. I am very passionate about my career. I worked in perio for quite a long time. In the better part of the last 15 years, I have been involved in implant dentistry. And today's topic is something that I hold near and dear to my heart. I am very much a proponent of gaining knowledge and understanding how to take better care of our patients. We're going to talk today about hygiene, home care, and why proper protocols must be put in place in your practices to take care of your implant patients. We're going to focus today on full arched fixed restorations, chrome guided smile. So I want to thank Rowe Dental Laboratory, who I am partnering with today. They're located in Independence, Ohio, and they're a great team. Rowe has been involved in chrome guided smile for better part of 4 years, with 6,500 arches under their belt. So they're great experts in this. And I encourage you, if you want any more information about chrome guided smile, to get on the website. You could actually set up a one-on-one meeting and learn a little bit more about that. So big shout out and thank you to Rowe. So every single implant course starts with a little bit of statistics, and I'm not going to be different. However, I'd like to take a little spin on this in a different fashion. We know that the majority of the aging population is 65 and over. People are living longer. This predominantly is our baby boomers. The baby boomers have really taken an active part of creating a healthier lifestyle for themselves. In fact, the closer I get, I do believe that 65 is the new 45. People are wanting to do different things to maintain health overall, and it doesn't stop in the mouth. As more and more Americans lose teeth, we know that the statistics show us that 36 million Americans don't have any teeth. Xerostoma, medication, things that they're doing are increasing this population of needing implants a lot more. We know that the implant industry is going to continue to boom over the next 15 years. So what does somebody like this do? These are the patients that you see in your practice that come back maybe after years of being away. These are people that are everyday patients. This is the gentleman whose wife is telling him he has bad breath and he better get back to the dentist. He probably has had past perio surgery. He's got some reoccurring decay, and he's just overall miserable about the way his mouth looks. Does he have to have a life sentence of dentures? We all know the problems with dentures, the fit, being able to speak, go out in public and eat. Ask your denture patients, if you see them, how many tubes of fixative they need to keep their dentures in place. The results are astonishing, and actually it's been said that you need to replace the denture every 3 to 5 years for it to fit properly. So the beauty of all of this is people now can do something different. This is a woman who has had severe dental issues in the past. We were able to do a smile simulation on her to show her what the before and after was going to look like. That alone can help case acceptance, and all you really need is a photo on your cell phone to get the process started with this. So this is a patient, you could see her before and after. She made the decision that dentures were not going to be something that she was going to look at. These are removable or fixed restorations, not removable. You place implants and you screw in a prosthetic that is going to stay in the patient's mouth. It does not come out. This is what chrome guided smile, a case, looks like. And what chrome guided smile is a pre-planned, fully guided surgery and prosthetics, which means that a one-on-one session is set up with a CDT or a DDS at your lab, and you fully guide and plan this case from start to finish. There will be a bone reduction guide included, a guide to place the implants, a guide to place the abutments, and then you go ahead and screw in the provisional prosthetic right at the time of surgery. The beauty of guided surgery and using the chrome system is the bone reduction is going to be flattened, which is going to make the hygiene in this area in the patient's mouth much easier. They're going to have much better access. As you can see here, this is not just for implants. It is case by case. It can be for, but they will plan the case accordingly. The number of implants does change. The unusual part of chrome-guided smile, we think of edentulous patients wanting to jump in and make a difference. Of about 100 chrome cases, only 5 of them are edentulous. So this is a procedure that is geared toward patients that are about to lose their teeth, not somebody that is a full edentulous case already. People do not know the option is there. Just having the conversation with them can make a life-changing decision for them. This patient's life, the way they are, their confidence, the way they present themselves in public completely changes just from having these teeth removed and placing something in immediately. You could see in this case, this patient had lots of recurring issues, probably wore a partial, broken teeth, lots of decay, failing crown and bridge, lots of reasons that this patient wouldn't want to keep their teeth. The thing with chrome-guided smile and any full arch treatment for that matter, it is a team effort. It takes everybody involved to make this case go successful. If you are a surgical practice, you are working with a referral team, and the support is there both from the general dentist and the specialist, so the teams are all involved. The dental hygienist is going to play a specific special role in this. If you're an oral surgery practice, you don't have a dental hygienist many times, and you're relying on the communication between the GP practice and yourself in these cases. The partnering with the lab is crucial in the planning stages, and the more we pre-plan these cases, the better success the patient has. And then speaking from my implant rep hat, involve your implant rep. They're a wealth of knowledge and have a tremendous amount of information that is going to aid in this case going the way it should go and being 100% predictability the day of surgery, that you have all the parts and pieces that you need. They will go out of the way to make sure that the case goes off smoothly from their standpoint. So please do include them in this. Let's now shift our gear to what we're really talking about here, and that is the implant success. The overall success of implants has changed dramatically with the amount of implants that are being done. We used to say that implants had a 99% success rate. Now we're looking at about 93 to 95%, 94% success rate. And why is that? Lots has changed in implant dentistry in the past, even 15 years. We're doing more implants, more patients are being aware that there's options even for single tooth implant placement. So the treatment is offered. We're not as selective as who we're doing this on a lot of times. So you see these numbers go down. Patients aren't doing what they need to do to maintain the health of the implants. 64% of implants that are restored are going to have some type of implant mucositis. Of those, 18% are going to lead to peri-implantitis. Mucositis is completely reversible. Mucositis is an inflammatory response that affects the tissue around an implant. Once we start losing bone, it becomes peri-implantitis. When implantitis progresses, we must seek treatment. You can see there's bone involved in the peri-implantitis. So if we start identifying these cases in the mucositis stage, we can prevent further disease, very much like gingivitis and full-blown periodontal disease. So the more involved we are in establishing a baseline of the patient and tracking them, the better we are. So controversial to some people, yes, there is a perio probe here and it is metal. We're going to talk about perio probing further on in the presentation. You do want to probe, but you're probing very differently than you would in a natural dentition. So why do implants fail? First and foremost is surgical and restorative skill. When you are doing a fully guided case, you eliminate a lot of the guessing work, and the predictability is far better. So with chrome-guided smile, when you're working with the team, you're going to have a better success rate of things going the way they need to go. You're going to have this pre-planned. The next piece is cement. Number one reason why implants fail post-restored. These are screwed in restorations. So you're taking that cement piece away. Occlusion is still a problem. I recommend checking occlusion at every hygiene appointment. I'll probably hammer that point home pretty good today. Then we're going to get into the overall health status and hygiene status of the patient and look at implant maintenance really closely here, because this is where the tremendous change and shift can happen. So again, you know, I like statistics. This is in 2016, this was the statistics and number of dentists versus hygienists and periodontists out there. I would imagine this number is going down after this whole COVID. A lot of people have retired. There's a lot of hygienists that have cut their time down. The demand is great right now, and the pressure for maintaining these cases is put on the hygienist. I don't know about any of you hygienists, but there's many times that I look like this. Now, of course, with all the protective gear we have to wear, we come in a hazmat suit. That's probably why she's wearing orange in the picture. But if you are detecting these diseases, you can stop them from progressing. It does get a little confusing. There's a lot of information out there. Nobody really understands which way to go in a practice. The front desk doesn't understand that if you're removing a full arch restoration, you need more time. There needs to be cross-scheduling. So we want to make sure that a protocol is set in place so that the proper procedures can be done and the patient has a positive experience when they're coming in. So I am really big about a baseline data. When you're doing a chrome-guided smile, there's an entire checklist that you're going to use for pre-planning the case. A lot of times, if it's a single arch, you can use this as your data, as your baseline data from moving forward. I recommend once the final prosthesis is put in place, that you have your patients come back and set up this baseline. You're going to check for mobility. Screws do come loose. You want to do a full mouth probing. All of us have cell phones. I shouldn't say all of us, but I'm guessing most of us have a cell phone. Just snap a couple pictures so you can see what the tissue looks like. It is pretty much a recommendation on what I'm going to tell you right now as far as practices and recare goes. But setting up this is, again, we're giving you guidelines for a protocol. Most of this can be determined by the patient's health. If you have a patient that is periodontally involved and is going to have this full arch treatment done, you really want to keep close eyes on what's going on with home care. And I would say every 3 months rather than 4, but for sure every 4 months. I recommend even on single tooth implants, at least the first year you get that patient in a little more frequently, but if they're good patients, 6 months is fine. So talk about this and figure out what's going to work in the practice and set that protocol in place. Checklists are out there and available. This is a standard checklist for a full arch maintenance. We want to make sure we update the health history. Radiographs. Many times we see patients that have had a single arch done and they're so pleased with the results they want to come back and have the other arch done if they're in something removable. Radiographs, tissue health, oral hygiene instructions, always go over that. Probing, again, we'll talk about mobility and occlusion. And the big thing is removal of the restoration. This is where we really have to have a pre-plan in place to decide whether to remove or not. There's not a whole lot of information out there. We used to have the prosthesis come out once a year. The Journal of Prosthodontology says only if there's a problem. Most people are doing this every 1 to 2 years. So make sure that you know whether that patient is coming in, if this is the time the removable is coming out, or if that we are going to remove the permanent prosthesis. And what we're going to do now from this point on, this is how you're going to treat, whether it stays in or out. Then I will show you what the treatment is for removal as well. Step 1, I am all about the conversation. My favorite tool in the operatory is the hand mirror. Hand it to the patient, retract the lips, and show the patient what their mouth looks like. They've put a lot of time and money and effort into this. Show them how beautiful that restoration is. 99% of the time, patients are going to come in and tell you how great this has been, what a life-changing decision this was. Are they keeping it clean? This gives you a perfect opportunity to look along the lip here to see where there's plaque. Ask them what they're using. Open-ended questions. What are you using for home care? Do you have any problems? Are you noticing any bleeding? Does anything feel loose? How does it feel when you bite? Have the conversation so the patient is involved. The ultimate goal for us is to keep and maintain a stable, infection-free environment. That is going to guarantee the success and the longevity of these restorations. Radiographs, sorry to tell you all, bite wings aren't cutting it. You need to take periodic periapicals. I recommend once a year, and a CBTC scan probably every 3 years. Certainly if they're experiencing a problem, go ahead and do the scan. You can see that this scan shows where the implants are, how they're placed, and we want to know that everything is staying stable. So when we do this, what are you really looking for? When we start getting clinical, that's where we get into the weeds. We know that healthy tissue is pink, firm, and healthy. When inflammation starts, we start rapidly seeing progression of changes in the color of the tissue, the tone of the tissue, exudate around the implants will be evident as the disease progresses. Remember, the body's inflammatory response is the same. If there is a foreign substance subgingival, you're going to have an inflammatory response. This is what it looks like up close. This is a bar here where you could see the plaque. That is a biofilm and plaque that is accumulated. Even look at the top of the screw heads where you see, that tells me that this patient is not thoroughly keeping this area clean. We want to make sure we give them the right tools so these areas stay plaque-free. Color and tissue consistency and tone is really important when evaluating this. You could see a little plaque coming out around the top of this restoration, but the tissue still has a pretty pink, little bit of inflammation right here, but it's really pretty and pink. When we get to something like this, you start to see the breakdown. We see the plaque accumulating. We see the biofilm there. You could see the recession and the bone loss that's happening along the whole buccal surface of that. You could even see part of the implants exposed. This is somebody that needs to have this prosthesis removed and a full evaluation done and probably sent back to the specialist. There's trouble starting and brewing here, and this patient, the sooner we see this, the better off we're going to be, and the success for the patient is really what it's about. When we take that off, this is not the same patient, but this is a good example I wanted to show. You could see what the tissue looks like. Now, there's some problems on this implant right here, this one here, and the tissue tone, you could see this patient is doing a pretty good job in the anterior portion of their mouth. Where they're missing is the posterior. That is going to clue us in on different modalities for them to use at home to keep this clean. This may involve some periodontal treatment to stop this disease from progressing, but again, that's for the specialist to look at. The only way we're really going to know if disease is starting or happening, even early on, is by probing. Remember, when you probe a natural tooth, there's a periodontal ligament. The periodontal ligament is going to give you the measurement. So if somebody with a 4 or 5 millimeter pocket, we're starting to see disease. Numbers aren't as important when you're looking around an implant. It's going to give you a baseline when we start seeing changes. Many times implants are placed pretty deep, and if you're getting a 4 or 5 millimeter reading around an implant, it still could be healthy. What you're looking for is BOP. Bleeding on probing is going to indicate whether there's an issue. Now, this is a plastic probe. You can go ahead and use a plastic probe around these, or you can use a metal probe. It is the way you're probing that matters most. You do not want to put excessive pressure around an implant when you're probing. Very gentle, and you want to hit every area. Note the spots that are bleeding. This is when you want to pick up a camera possibly and take a picture of this. Write down the measurement so the next time that patient comes in, you have a starting point and an ending point. This chart is great. For me, it really hones in on several things that are going to send a red flag up for us. Bleeding on probing doesn't always mean disease. That's where we want to go back to the thorough health history. Are there hormonal differences going on? Are there medications that the patient is possibly taking? Are they a diabetic? Those are all questions, and is the diabetes under control, that we want to ask. The absence of bleeding will indicate that everything is healthy. So if there's no bleeding, you have a healthy area. Very rarely will there be a problem unless it's something to do with occlusion. But if there is any type of exudate, we know that something is going on. So this is a good guideline, and my email will be included at the end of the presentation. We are recording this. It's going to be available on Ro's website. However, I will send anything you want, the charts that I'm going to show you. Please feel free to reach out. So we cannot talk about implant care without talking about the hottest topic right now going on in hygiene and home care around implants, and that's the biofilm. Biofilms are everywhere in nature. They form everywhere in the mouth. And one of the most important things that we want to do is be sure that we are removing that biofilm. When you have a patient that has early disease and you do a proper cleaning and we take care of getting the area back to health, you remove the biofilm, you want that patient back in 4 to 6 weeks so you can check the status of the home care. You could check to see how the tissue is responding, and you possibly can remove more of the biofilm that's formed. So a biofilm is, for those that don't know, is a sticky group of colonized plaque that are going to organize in a very, we know more and more about biofilm, a lot of really good information out there. It's changing all the time. What we do know about biofilm is that it's super smart and it communicates within the bacteria. So the bacteria are talking to each other and they can mutate and change in different ways. So again, we could do a whole course on biofilm. This is just to touch on it, knowing that we want it thoroughly removed from the bodies of the implants. The best way to remove biofilm is an air polisher. I do not work for a company, so I have several different ones out showing any way to remove the biofilm is what you want to do. There's a lot of different modalities to use. Glycine is the #1 powder used right now, and there's some new things coming out on the market. Again, this is not a biofilm lecture, but you must be aware of it. So if you are treating patients with full arch restorations and you don't have a air polisher in your practice, please make that something that you add to the wish list. Bring the reps in. There's a lot of good information. They're more than willing to come in and do a lunch and learn and teach you about these specific products. When we talk about the chrome guided smile, the way we talked about bone reduction and flattening the surface, this is exactly what we were referring to. This is a beautiful restoration that the patient has access to keep clean. We're going to offer them lots of different types of tools to use. Electric toothbrushes are great. There's a lot of different electric toothbrushes out there. Again, offering patients these at the practice is really a good way to drive home what you want them doing. They're going to remove the plaque and the biofilm just by getting underneath there with skinny sulcus brushes, proxy brushes. We're going to talk about flossing underneath these restorations in a bit, but keeping this clean is definitely something that is done intentionally. You want to make sure they have hygiene access there. This is one of my favorite charts. I got it offline, but it really is, I'm all about flow charts. I really like this. It helps my brain think things through. And sometimes when you're in the middle of your crazy day, you don't really know which way to go. So this is a really helpful chart to tell you what to do from just early onset all the way through to disease. And again, I'll make this available to you. Just let me know that you want it. So we've covered several things so far that are common whether you are going to remove the prosthetic or leave the prosthetic in place. We know that your recare, 3 to 4 months for sure on a full arch. We want to make sure we get these people in and establish a good protocol in place of how often they're coming in. Radiographs, perio charting, biofilm removal, and now we're going to talk about scaling, mobility, occlusion, and home care. So it's crucial that you have the right instruments in your practice to maintain implants, whether it's a single tooth or a multi-unit fully fixed case. Without proper tooling, you cannot be successful. So for those of you that still have old plastic scalers in your drawer from 1999, throw them away. They go in the wastebasket. Studies are showing now that the bits of plastic can remain on the body of the implant. Calculus will form underneath these prostheses. We need to remove it. Any way you can get this calculus off, you need to get it off. So you could see there's a variety of titanium scalers available. Some come in cute little kits. They come with probes. You need to have titanium scalers of some sort in the practice to remove the calculus to the best of your ability, as well as I'm a big proponent of ultrasonic scalers. I like them. I'm not going to push one product or another the same way. Plenty of reps out there, especially now, that would gladly come and give you all the information. But I highly recommend looking into this if you do not have a good ultrasonic scaler in your practice to take care of these full arch cases. Mobility and occlusion check. Every implant case, I don't care if it's a single implant or a multi-unit case, you must have an occlusion check every single time that patient has their teeth cleaned. Natural dentition shifts. Implants are designed not to. If the bite is off even a little bit, it could cause problems for the implant. So just have a piece of articulating paper or shim stock or whatever you're using normally to check bites available to the dentist when they come in to do the exam. Mobility, you're just going to check mobility to make sure that single implants aren't loose, the crowns don't come loose, the abutments don't come loose. On a full arch, if the bite is off and they're grinding their teeth or occluding, those little screws that are holding the prosthesis could come loose. And we want to check that each time the patient comes in for a recare check. So let's look at removing the prosthesis. What do we do when it's that time or there's disease present or we feel we've set up a schedule that the prosthesis is going to come off? Before you do anything, you must stop and you must make sure the right tools are available to you. Again, I'm going back to my implant wrap hat. There are numerous companies that we work for with Chrome Guided Smile. As long as the implant company has a fully guided surgical kit, we could adapt. So we have different companies with different screws, with different drivers, with different torques, with different torque gauges, with different torque values. Know your company, involve your implant rep. They love to come and help with cases like this. Most of the time, implant reps don't get to see the finished product 4 or 5 years out. We'd like to see how these things are going. So this is a good opportunity for you to involve them. But please be sure you make sure you have the right tooling, the right screwdrivers, the right torque wrenches available to you. This is what it looks like once we remove the material that's covering the access holes. The current trend is Teflon tape, and you can use a composite material or whatever you're choosing to fill in. You remove that. Then you're going to carefully remove the screws. Again, these screws are very little. So if you are going to place the same screws back in, I recommend you go by the implant company's recommendation. Some are saying you have to change the screw every single time you take it out. Some are saying you can do it twice. So that really is company specific, and I encourage you to ask the questions. Once you remove the screws, you are going to take the prosthetic out, and you're going to see what it looks like underneath. You can see this patient has a complete area going on right here. There's exudate, there's plaque, there's a little inflammation and bleeding back here. The same thing right here. We're going to clean this patient up. This is many times what you're going to see underneath. This is why we don't recommend long-term Paradex. We don't know if this is smoking, a pipe, tobacco, but my bet is that a lot of this comes from Paradex. So we've switched to Listerine or other mouth rinses long-term that aren't going to cause the stain. You have to remove that stain because it's a local irritant on the tissue. It needs to come off. Use a Cavitron, put it in an ultrasonic scaler with tartar and stain, a tank with tartar and stain remover. This is what you want it to look like when you deliver it back to the patient. Nice and clean and pink and pretty. This is not bad. So the prosthesis comes off here, and you can see a little bit of calculus right here. It's a little bit inflamed right here, but overall, this looks pretty pink and healthy. This is what you're going to see typically in someone that's taking good care of the area. Once everything is cleaned, we're going to screw this happens to be a provisional, but we are going to screw the prosthesis back in, the same prosthesis, nice and clean. Then you're going to take a piece of Teflon tape, fill the access hole, and use Cavit or bonded material, composite, whatever you're using to fill the access holes. You want to make sure the product is available. Crucial step here, make sure you're using a round burr or a diamond burr, something soft that you can go ahead and flatten that surface out. You want to make it nice and smooth so the patient's tongue is not rubbing all over that roughened area that you've created. So truly, to be successful in removing these prostheses is planning ahead. You want to make sure all the materials are available to you and that you have an action plan if there's a problem. So the best laid plans have a certain guideline that you're going to follow each and every time you do this. So I encourage you to have these meetings, team meetings, where you are putting something in place that you're always going to follow. Here again is showing Hygiene Access. This is a beautiful chrome-guided smile case, and you can see how much access this patient has. Now, it's not a gaping gap, but it's enough that we could be creative to helping this patient keep this clean. And this patient is doing a really good job. The tissue looks nice and pink and healthy, and they're removing the plaque. So you're going to use thin bristle brushes. There's sulcus brushes, proxy brushes, and tuft brushes. Several companies right now are making implant kits that they can use. But again, we want that patient to be able to get underneath there and keep that area very clean. There's a variety of products shown here. What I want to really hone in on right now is the use of superfloss. We are no longer recommending superfloss around implants. Studies have indicated that some of the thick, fuzzy floss can stick on the implant. And it does not matter what is subgingival. If it's a foreign substance, it's going to cause an inflammatory response. The inflammatory response is going to cause the problem. It's also going to attract more biofilm. So we don't want to use superfloss. They can use a floss threader and regular floss underneath, but that is how they're going to keep underneath those restorations clean. I also believe in writing it down. If it's not written down, it doesn't happen. And there's a lot for patients to remember. So have your set schedule of home care regimen available so the patient can follow what they need to follow. Water picks, I like water flossers. Water picks are great. You're going to use floss threaders, interproximal brushes, electric toothbrushes, and the mouthwash that you choose. Listerine is usually the one that is recommended. But definitely write it down and give it to the patient. Review with them what is working and what isn't. When some of those cases have a little less gap, they may have a little bit of difficulty. If you have a patient that's disabled, you're going to have to get a little more creative. But we want to take these cases and treat them in the same fashion we would if somebody has periodontal disease, especially if they lost their teeth due to periodontal disease. The likelihood that the plaque and biofilm are forming back up and calculus is forming back up is pretty good. So keep real close tabs on them. These patients have spent a lot of time and money, as we said, and effort and thought process to change the course of their life. Not one of them will say they regretted the decision. When you could take a patient that looks like this and start a conversation, very simply, the first question is, are you comfortable with the way your smile looks? And then take it from there. Asking the patient if there is an important question. A lot of times these patients don't know that they have the option. It's our job to help the patients make the right choice. And then it's our job to help that last a lifetime. So I really want to thank you for joining me today. This is a good overview on setting up the proper protocol in your practice. There is my information, Heidi DuBois at practicedynamics.net. Are there any questions?
All right, Heidi, thank you very much. Great program, a lot of good information there. We do have a couple questions in the chat, and then if anyone has any questions, of course, you can use the chat feature to ask the question, and I'll moderate it here. The first question is, which implant brand do you recommend?
We do not recommend an implant brand. As long as the implant has a fully guided kit, Chrome Guided Smile can work with almost any implant company.
All right, and the next question is, when cleaning and polishing the intaglio, what materials do you recommend?
I personally am not a fan of using any prophy paste at all for fear of scratching everything. If you want to use a rubber cup, that's fine, but an air polisher, in my opinion, is a 100% necessity in a practice that's doing this type of restorations to be sure that that biofilm is getting clean.
All right, and it looks like that was the only two questions, so that means you had a very thorough program. So I guess we can go ahead and wrap up. If there's any questions that do come up in the future, of course, you can contact Heidi, which her email is on the slide here, or you can send a message to Road Dental Laboratory as well. Thanks again, everyone, and hope everyone has a good day.